Hello, everyone. Welcome to Talking Health Dr. Laz, your favorite health program on television. Yes, as you can see today, I'm at the Nigerian Institute of Medical Research, Yaba, Lagos, Nigeria. And today, the National Advocates for Health came and had a tour to identify the needs of this institute and also the progress that have been made over the years with the funding that has been made available to this research institute. I'm the secretary of the National Advocates for Health, so I'm not just here for reporting, but also as one of those Nigerians that are making deliberate efforts to bring up key health issues in the country and ensure that adequate attention is paid to them. So I'm very excited that we are here today, and I'm going to be telling you some stories on what has worked well at NIMR and also what we need to do to make sure the center, that this place becomes the center of excellence and the destination in sub-Saharan African region for all issues related to medical research, especially the local vaccine development and local vaccine production has been canvassed by a lot of health experts and Nigerians at large. We are going to take a break, and when we return, I'll take you around this institute, and of course we are going to hear from members of the National Advocates for Health, many of who are eminent Nigerians with huge experience and contributions to national development. Please stay with us, we'll be right back.
When we talk about young scientists, we are going to see many of them in the lab because in the last few years, NIMR has attracted most of the young minds in Nigeria who saw NIMR as a place to acquire practical skills which they didn't have in their universities. So we have quite a number of young people, both as students. You will see them, you can talk to some of them. We have quite a number of local products that we have done. And we have, this year we've set a target of about 3 for ourselves. One is almost ready. We are hoping to develop an hepatitis B diagnostic kit that can also measure viral load. One, because the one we buy from outside, from time to time we are not able to get it to buy. And people want to do tests, you cannot do the tests. Sometimes they would have paid, they would have collected sample, the kits will not arrive, and people will be complaining, this and that. So we charge them that, one, we have developed that, so if we've developed this before, then you can also do the others. And I think that is almost ready. Then we're also looking at cholera diagnostic tests. That one like a point of care. We are looking at something like a dipstick. We just dip into the stool or urine or blood or whatever, and we'll be able to come up with. I believe the third one was more of an ELISA diagnostic kits for screening for COVID. We are looking at maybe universities or schools where they want to do screening before the students are going to go back to school or going to boarding houses. So those are the ones we set out for ourselves this year, and we are working very hard on that. But what we don't have are infrastructural support. And that comes from government support, government funding. For research, government continues to be the largest spender.
NIMR has been exceptionally good in trying to sustain things. For instance, this instrument we are using, was purchased in 2008 as one among three. The others have stopped working over 10 years ago. This one is still working. It's been in use in 2008, and so is a lot of things here. We've been continually improving things, and with this COVID that came, and we even some funding from government, we've been able to purchase newer instruments. So we are now doing NGS, next generation sequencing, with Minion and different things. So to that, we are moving forward. And one of the things I also pick from this, they're now calling health and industry. And you can see all the people we have, different people. Some of them have actually finished here, and they've gone ahead to start working in the health industry.
You need research to continue to practice efficient and effectively your medicine. So for me, it's an eye-opener. They are doing quite a lot. I didn't expect to see this much. And the challenge for all of us here is to continue to support them with advocacy to reach the maximum where they want to.
Let me first appreciate the effort of the Nigerian Institute for Medical Research for doing what they are doing in terms of control and prevention of all our outbreaks in Nigeria. This is a big place that requires a lot of funding from the Nigerian government. We had a discussion about the issue of Lassa fever vaccine. Lassa fever vaccine requires a lot of funding and budget. So we are calling on the National Assembly, we are calling on federal government that from next year, 2023, there should be adequate funding for Lassa fever vaccine. Not only that, we should also invest in the COVID-19. We are not done yet. We have to be on our guard to ensure that we don't have any another wave of the COVID-19. The overall health security in Nigeria, we also need funding, public emergency, the port health, and every other effort in Nigeria to strengthen health security. We need to have adequate funding. We should encourage private sector investment. We should encourage development partners to partner with the government. We should also encourage our business community. That is our philanthropy, to also join the government in putting adequate funding for health security and also health financing for overall health sector. It's very viable. We have to be serious. We have to be organized. We have to be focused. We have to develop the investment case. We have to put the business case to really win a lot of partners. We cannot do it alone. So Nigerian government, the local partners, we have to partner with the international companies to come to Nigeria to invest and develop the companies here. We don't need to be going to any other African country or going outside the Africa. We can invite those companies to come to Nigeria to work with us and create the companies and the plant that will develop and manufacture the vaccine in Nigeria.
Yes, at the Nigerian Institute of Medical Research, we've been able to observe what I feel is efficient utilization of resources. As national advocates for health, we've been pushing a lot for more funding for health. And here, Nigerian Institute of Medical Research cannot be said to be one of the agencies or parastatals in the Federal Ministry of Health that gets lots of funding compared to others. But we've been able to see very positive developments, how they leveraged on COVID-19 funding, how they were able to get partners to procure a number of equipment in the laboratories, provided opportunity for research, and involved young people, students, young researchers, building capacities, as well as developing products. I'm also very pleased to know that they already set up sustainability plan for some of these equipment with investments, with sustainability plan having to leverage on the needs within the West African sub-region. So I'm really excited, and I do wish that the government of Nigeria invests sustainably in research. It's not just a dash, because the monies invested can also be used to generate some other money. Let us be the giant of Africa. Let us be the big brother and provide solutions to the medical research needs of the West African sub-region. Let's make Nigeria a destination for research, not just West Africa, but for the entire Sub-Saharan African continent. Let the policymakers not just see this as spending money, but also as an investment that is going to pay Nigeria in so many ways in the area of health security, where we ensure that we have local solutions to prevent all sorts of biological threats that may emanate in future, and at the same time generate funds that could be used to support our health system.
This has been a wow experience. Being able to see things that one has seen abroad, having them here, to see the equipment that we see abroad, especially for people who go for medical intervention abroad. You see that things are able, we are able to do them here. I'm walking so tall and proud that Nigeria for Nigeria by Nigerians is possible. And the possibility of what NIMA is doing is what should encourage government and encourage investors and encourage every other person that together we can build a strong health system that will work. And research has been said to be an imperative in what we are trying to do, in the reforms to make health functional in Nigeria. So we need to start thinking through and getting to speak to, let's say, what we call research culture. People will wonder, how did I get my glasses? If the research was not done, we probably would be banging on each other, all half blind. If there was no research in terms of how the computers are working, where will we be today? The world has become a global village. It took research to bring us to where we are. So research is part of the development system, and we need as a people, to embrace research. And embracing research means that NIMA must not die. NIMA must work for all of us.
I think they have done extremely well in terms of infrastructure as well as professionalism, because we are seeing equipment here that are quite scarce in the whole of West Africa. So I think the leadership as well as the staff need to be commended and encouraged as well. But anyhow they can get other research institutes involved in collaboration, there must be cohesion. And we can now say we are the giants of Africa. I can see it coming, and we pray that it will materialize. Kudos and well done.
The last time I was here was about 5 years ago when I was in the House of Reps. Then we came as a committee. And 4 years down the line, what I'm seeing here, or rather what I have seen today, couldn't really believe it. This place has been wonderfully, transformed under the leadership of the DG and his management. Cannot really believe seeing certain machines, certain equipments, which are more or less not available in other countries, but Nigeria. And it means there are lots of potentialities. All we require, to do as advocates is to continue to talk, to the government, to continue to support, this institute, because I believe with the right, support, with prioritization of research, this center will do wonderfully, and it can serve not only Nigeria, but Africa.
My experience has been mind-boggling. I'm absolutely impressed by the level of research that is going on in NIMA. And I'm also extremely impressed by the leadership, who is totally committed to qualitative research. In addition to that, one has seen a facelift in the environment. The environment has been upgraded in several ways, but in particular, internally, the infrastructure. The infrastructure is modern. There are many equipments here that they are the only one that have such sophisticated equipment. In addition to that, we observe that capacity building for young scientists is a priority for the research center. And I think also it's worthy of note that there are several undergraduates and graduate students taking advantage of the qualitative research work going on and the research equipments in order to upgrade their own skills. thus contributing to research output from Nigeria. I'd like to see more centers like this in Nigeria. NIMA has taken leadership, and I have no doubt that they can extend their activities even beyond the shores of Nigeria. I know in the future there are a number of research protocols that will be developed in addition to policy documents. And the message I have for the research center is that even when the leadership is to change, they should employ somebody with the same level of commitment and experience who certainly appreciates the quality research that is going on. The healthcare system cannot be functional efficiently without research. Research is priority.
Yes, that's the much we can take today on this, and I thank you for watching. I join all the advocates and of course the management of Institute to call for more investment in research. It's not just spending, but also an investment that will be very beneficial to our country in so many ways, because it's going to help in our national security, it's going to help in our health development in a sustainable manner, it's also going to help in creating jobs and going to help our economy. From the Nigerian Institute of Medical Research in Lagos, I'm saying thank you for watching the program today. See you same station, same time next week. Bye for now.